come with very late diagnosis, making treatment difficult and often futile in many cases. So a screening program which is supported without significant out-of-pocket expenses really can bring succor to patients and really improve quality of life and care. And I really think that's something that can really make a difference in what actually the country and the healthcare system should be focusing on, is early diagnosis, prevention and treatment. We often in medical care, we are often reactive. What I mean by reactive is we wait for patients to come to us and then they are terminally ill and then we are trying to do heroics, and actually it's a lot of financial burden on the family and often does not achieve that much, while a much lower cost program that we will be able to achieve. The second is the pharmacy college. I think Ronald put it nicely in his presentation, why the pharmacy college. We are a 125-year-old institution and our founder, right at the onset, the first college she started was actually a pharmacy college. The first person she trained was a pharmacist. Gives you a sense of the importance that the founder in those days, a dream come true for us. And it also brings value additions without us having to tax our patients. Our education systems are very, very different from what you see in any other medical college. While we often talk about education as nursing and medicine, we actually run 172 courses almost all the allied health services, and pharmacy is going to be one more of them. Lowest cost in terms of the fees that we charge from our students. And almost all the courses have practically fees that are negligible to extremely low. Our philosophy is that your education came practically free. That's our vision and our goal, which we try to inculcate in our students. And the pharmacy college especially is going to be a significant boon, especially to people in the local area who can now acquire a training and a world-class training to then go out and serve, not just in CMC, but in many places. Many training programs in the country often unfortunately lack quality and there are serious challenges. And that's something that we don't plan to combat. So to make all this possible, we are truly grateful to you, Federal Bank, for making this possible with your generous donation, really a generous donation. We also recognize that we are just stewards of this grant and we are accountable for what you give to us. And what we actually ask our CSR donors is, please come back and assess us every year. And if we are not transparent and true to what you have given to us, then we should be held accountable. And I assure you, in our systems, we try our best to maintain as much transparency as possible, that any questions that you ask of how donations that you have given us, we don't take it lightly. We recognize this is an important resource that you could have given to anybody else, and we intend to use it well to make sure that it benefits our community and in our shared vision of advancing.
Dr. Vikram, Dr. Thomas, Samuel Ram, Dr. Ronald, Dr. Salvamani, and Reverend Finny Alexander. I am glad to be here today. I am also told that this is the 125th year of this organization, and it's a milestone year for the organization, and we are happy to be here extending our partnership with CMC, Vellore, beyond what we started this association with. Just to give you a background, we started our CSR is founded on essentially three pillars largely. One is healthcare, second is education, and third is skills. And healthcare is one amongst the three pillars of our CSR initiatives. And our association started with Sanjeevani during COVID times and extended beyond that and morphed into cancer awareness kind of a program. And that's where we started. And then we realized that awareness is of course very important, as Dr. Vikram mentioned. Early screening and early detection are very important in cancer care. It is important, but then we realized that that's not enough and we need to go beyond screening, because with all good intentions, with all the screening, there is still, you detect cancer and then treatment becomes a huge problem for patients. And then we extended our program to screening and then patient support. And in fact, we have grown the patient support from early, when we started we were at 25,000 kind of number, and last year we enhanced it to 4 lakhs because we realized that cancer treatment is expensive, and 25,000 was really inadequate for patients to really seek the right treatment. So we grew that, and then our program kept evolving, and as I said, education and infrastructure for education and infrastructure for medicine were the next natural things for us to work on. So we started working with some hospitals to create medical infrastructure, and with CMC, through this program, one of the important things for us was that we needed a trusted partner on spending our CSR money, because we are finally accountable to our shareholders and our stakeholders to make sure that we make good use of our money. And therefore, it was important for us to work with a trusted partner, a reputed partner, to make sure that our money is, our shareholders' money is well spent. And CMC was such a partner, and therefore we saw an opportunity to expand this relationship with CMC beyond just the screening and patient support that we were extending. This College of Pharmacy was an initiative that came up, and we were happy to expand our relationship with CMC in financing the creation of that infrastructure. So the way we see it is, as hopefully our profits keep growing and we keep doing well, and this pool of CSR funds keeps growing, and it is important for us to find largish initiatives to deploy our money into things that will make long-term impact. And we saw this initiative as an initiative which would make a long-term impact, and that's how this initiative came into play. And we are really glad that we've been able to make a dream come true for the institution, and I think I'm sure this will help benefit much wider cross-section of people who come to seek help and medical help at this institution. It's also important to know that Tamil Nadu is kind of second home to Federal Bank. Its first home was Kerala. Of course, it was born there, but Tamil Nadu is also its second home. It's our second largest network of branches sits in Tamil Nadu, and therefore it's a community that we serve in many ways, and we are happy to add on to that with this initiative for this community. Thank you CMC for being our partners, and thank you all for coming today, and we are really excited.
We're moving into the MOU exchange ceremony. I request our Director Dr. Vikram Matthews and Mr. Manian to go to the MOU for the Pharmacy College, setting up a state-of-the-art pharmacy college to provide an education of the highest standard.
Thank you.
Thank you.
For the Sanjeevani program, I request Jitesh, PV Senior Vice President and Zonal Head, to be a part of this exchange of MOUs, and also Dr. Selva Mani, our Associate Director, Thomas. Thank you. So we thank you for Federal Bank for the Sanjeevani program. This partnership began in 2020.
This is Federal Bank is known as the principle of digital at the core, human at the core. In a word, where the people often the bank as a just transaction focus, how is the principle applied in the real life?
In a fast-moving world where technology is becoming all pervasive, I think human relationships need to still sustain. And finally, technology must make us efficient, but relationships are built by people, and therefore our philosophy is that we often say that रिश्ता आपसे है, सिर्फ ऐप से नहीं. Yeah, apps are important and they serve our customers well, but finally our relationships are with people to people, and our business, like in medicine, it is people trust doctors, that's a human emotion, right? People trust bankers, it's a human emotion. So I think it's important to bring the human emotion into real life and business, and that's what our belief is, and that's what we think serves our business well in the future.